good afternoon, or good morning, or evening, wherever you are. I want to thank you all for joining us today. My name is Karen Berman. I'm the CEO of the American Society of the University of Haifa. I appreciate that we're all operating in a very different way than we were just a few weeks ago. In fact, I think for all of us, the news keeps changing on an hourly basis. Just today, the Israeli universities announced that all classes of over 100 or more will be online, and we expect to be moving all of our classes actually to online only in the next couple of days, although our research labs will be continuing to operate. We are very proud of all the research that we're doing, and lucky to be able to take advantage today to give you some vital information and address perhaps some of the questions that we have on the coronavirus. And we're very fortunate that our discussion today will be led by Dr. Manfred Green, the director of University of Haifa's International Master's Program in Public Health. This program is actually one of only 3 accredited programs outside of North America that takes an interdisciplinary approach to educating the next generation of public health leaders and prepares them to address the health of Israel's citizens while operating effectively in a global health environment. Our graduates graduate both with master's or PhD degrees, are taught by expert faculty from around the globe, and our faculty are dedicated leaders who are prepared to take on what are becoming increasingly more complex public health challenges. Dr. Green is also not just the director of the program, he's a professor in the Department of Epidemiology, and he serves as an adjunct professor at University of Georgia College of Public Health here. He's a past head of public health, of the public health branch for the IDF, and he was a founding director of the Israel Center for Disease Control. I want to thank Dr. Green for his time. I want to thank all of you. I'm going to turn the mic over now to Dr. Green and to Jake Scharfman, who will lead us through this conversation and give you some just some logistics on how to ask questions and get through the process. Thank you all very much.
Thank you so much, Karen, and welcome to all of our guests from around the world. As Karen mentioned today, we're joined by Dr. Manfred Green of the University of Haifa School of Public Health, who will brief us on a topic that seemingly at the forefront of everyone's mind right now, the COVID-19 virus, or commonly known as the coronavirus. On Monday night, Israel imposed a 14-day self-quarantine policy for anyone arriving in the country. And just last night, US President Donald Trump instituted a travel ban on 26 European countries because of the virus, which is also spurring the cancellation of major sports leagues, conferences, festivals, as well as classes on college campuses, and among other things. It's difficult to know precisely how this evolving situation will unfold, but today Dr. Green will try to help us sort fact from fiction. His research expertise includes emergencies arising from infectious diseases, epidemiology, and vaccines. After the interview with Dr. Green, we will open it up to questions from the audience, which you can submit at any time during this briefing via Zoom with the Q&A button at the bottom of your screen, not the chat button, but the Q&A button, or by emailing info@asuh.org. That's info@asuh.org. So Dr. Green, let's get right to it. As the former head of the public health branch for the Israel Defense Forces, as well as the founding director of the Israel Center for Disease Control, you've encountered a lot of public health challenges over the years. How does the coronavirus panic compare to other public health scares?
Thanks very much, Jake. Yeah, you're right. I mean, these kind of events occur not exactly the same, but they occur, shall we say, not infrequently. The one that I would remember is the polio outbreak in Israel, which, although there were only 15 cases, because there is it's a disease that spreads, it's easily contracted, it's contagious, and it was unusual for us to have an outbreak. I was then head of the public health branch in the IDF, and together with my colleagues there, we decided to vaccinate all the soldiers against polio using the oral polio vaccine. So this was a challenge where people were afraid. I'm pleased to say that was the last outbreak excuse me, that's the last outbreak we've had in Israel.
There seems to be a lot of misinformation going around about virus and what people should do, I think, to protect themselves. What are the biggest misconceptions that you've observed about this virus during this outbreak?
I think it varies. First of all, this is not a national disaster. This is a public health challenge, but it's not a disaster, and I think that should be made clear. It's a disease that is going to spread widely, and it's going to affect a large number of the population, we believe. Fortunately, it doesn't do damage or doesn't cause very much illness or bad illness in young people. We need basically to focus on the older population, particularly in terms of protecting them. And there are, as usual, for some reason, there's been so we say the public's been going and buying toilet paper. That's not quite clear to me. This is not a diarrheal disease, not a gastrointestinal. This is a respiratory disease. And if you want to look at the ways in which you're protecting yourself, basically what you're hearing is social distancing, meaning avoid big crowds and so on and so forth. And you've heard all these recommendations. But I think there's one point that's not been made clearly, and I would like to make it. People who are at high risk are those who have chronic diseases. And I think this is the time for those people to make sure that they're up to date with their medications and that they are actually having their particular condition controlled. So if these are people with heart disease, they will be taking their tablets every day, because we know that the compliance is not always very good. If they're very well protected in terms of their underlying disease, they obviously do much better if they contract this illness.
Sure. There are quite a lot of experts that don't seem to know yet about the virus. What don't we know as of yet about the coronavirus?
Well, we know a lot and we don't know a lot. We know the coronavirus very well because it's been around forever, and we know that it can cause common colds, and we have that in the winter, a form of coronavirus. It's also caused very severe disease like SARS and MERS. So we're seeing something here that's not as bad as the very bad ones, but it's a lot worse in that sense than flu, than the common influenza. We are not sure whether the virus is going to change its behavior and become less virulent. We do see that sometimes. In other words, that as the outbreak or the epidemic or pandemic now progresses, it is possible that it will be a milder disease. We are obviously hoping for that, but we still don't really have enough experience to know exactly what would happen. Obviously, it could change either way, but the experience is that usually they become somewhat milder over the time.
Mm-hmm. Just following that, how is this virus different from influenza, and why does it seem to affect some people far greater than others? Is it just because of their underlying health conditions or their immune system simply?
Well, it's a combination. Many of these viruses, including the flu virus, incidentally, are from animals. So the influenza virus is from birds. It's not a natural virus of humans. Mm-hmm. And it crossed over into humans way back hundreds of years ago, probably, and then gradually it adapted to humans. That's because of the receptors, and that's a kind of technical thing where the actual virus attaches on your cells in your body. The coronavirus is generally also an animal virus. So it's found in a number of sorts of animals, and it can adapt as it has for the milder forms, but the more severe forms have generally not crossed that barrier. So we had SARS and we had MERS. We think that this coronavirus came possibly from bats or other animals where we know carry this virus. And that virus then has to adapt to humans. And our experience is that when a virus who is naturally infecting animals crosses over to humans, it generally causes a severe disease. Essentially, I guess, because we're not adapted to it. So there are many others like Ebola, if you talk about the extreme ones, which are animal diseases or zoonotic disease. So this virus is actually a virus that's crossed that barrier. It's adapted to us and it's spread. So that's actually part of the reason. The other reason, as you said, is that it affects people. The fact that it's affecting people who have underlying other conditions, diseases, is not unusual for any viral disease, but it seems to be particularly severe here because it causes a very severe pneumonia. And very severe pneumonia in these people who have underlying conditions can actually be under considerable stress. It then obviously affects other parts of the body, but it primarily it's causing this very severe pneumonia.
Mm-hmm. Mm-hmm. How do you feel that Israel, in your opinion, is containing the spread of the virus? I mean, some have criticized the country for its decision to quarantine everybody that arrives in Israel. Do you think that, first of all, do you think that that's the right move? And do you think that the country is prepared should there be a massive outbreak?
So there are two parts to that. We adopted a policy of attempting to slow the outbreak. We knew that we were not going to be able to prevent it from coming in. A virus gets through if it wants to get through. It's like, as some people say, you can't stop the wind. It's going to get through anyway. So what you do basically is you put into place as many barriers as you can to slow the entry of that virus. And at the same time, you're hoping for two things. One is that when it does come in, the medical system will have prepared sufficiently to cope with it. And secondly, that it won't be an immediate large or very large outbreak. It'll be an epidemic that will be spread over time. So that you can imagine that if 10 people or 15 people come to a hospital and need to be on respirators, that's a big difference than if you had 100 people come in. Right. So we want to spread it out, basically.
Right, right. A report circulated last week that kind of got wide traction, that Israel might have its hands on a potential vaccine for this, which would obviously be a game changer. But some experts, I've read that are skeptical with that. What are your thoughts about a potential vaccine that could come out of Israel or in general?
Yeah, as I said, my interest is also in vaccines, and I've had some experience with people who develop vaccines and testing vaccines and so on. Developing vaccines is extremely difficult. I don't think that people maybe don't appreciate how difficult it is to develop a vaccine. It's not something that takes days, months, or something. It takes years to develop a vaccine. There are new technologies now which we hope will speed up that process. But if you think about it, even in the best scenario, even if a vaccine is developed, you'll have to still go through a large number of steps in order to make it available to the public, including testing it in animals, in small people, in small numbers of people, and then in larger numbers of people, you'll have to test for safety. So you're not going to actually start vaccinating millions of people with a vaccine that's not been thoroughly tested. That, in my view, even if a vaccine is produced very soon, that could take a year and a half, probably at the best estimate. And it's not really going to be applicable to this particular epidemic. We don't see it as a means of preventing anything in this particular. Obviously, you may tell me, well, let's be optimistic and maybe there's a new scientific breakthrough, but we haven't seen this yet. The closest, by the way, I just comment, the closest we've come is with Ebola, where Ebola was produced under emergency, the Ebola vaccine. But they had experience with Ebola. It wasn't as if it was something new totally. They'd been working on Ebola before that. So it wasn't something new. And although coronavirus is also not new. But, and even then, the Ebola vaccine, even today, is not really licensed, even though it was used partly in the Congo or in West Africa. Yeah.
Mm-hmm. Do you think Israel's in a good position, just given the, the infrastructure, the medical technology and innovation scientifically, to actually be at the forefront of developing a vaccine for this?
Well, I think that we need to be modest and make sure that we know that we are involved in the process. I mean, the scientists in some of the institutions, but countries like the United States, China as well, and many of the European countries have also very advanced infrastructure for that, and scientists who are working on. So it's basically a joint effort. It's basically each one complementing the other and each one trying to add to the knowledge and the ability of somebody else. So we would hope that this would be a joint effort, and presumably that's what's going on. We would certainly hope that there's a lot of international cooperation, because you need that at this time.
Sure. There's been cases reported in the West Bank. I just would curious, how do you feel the coronavirus, will affect the Palestinian Authority and the Gaza Strip? Given how densely populated those areas are, how do you predict that they'll be able, if at all, to keep the situation under control?
Yeah, there are discussions underway all the time between Israel and the Palestinian Authority I guess to some extent with Gaza. I think there are two concerns there. The one concern about it spreading widely is not that we expect it to cause a lot of bad illness in most of the population, because as I say, it doesn't affect young people really badly. But it could be a epicenter, a center which would spread the virus more widely to other areas. So that's certainly a concern. The other, of course, is that they don't really have the same kind of infrastructure that we have for treating patients who are seriously ill. So that's going to be something that we'll have to deal with if, in fact, there is a widespread epidemic in the West Bank and Gaza, because they'll need considerable support to actually treat very, very ill patients. Again, the elderly and those who have underlying disease. Yeah.
Right. Is it known whether people can become reinfected with this virus if you have the virus and develop, the antibodies or what have you to fight it? Can you get reinfected again once you have it?
Well, it's an RNA virus. In other words, it's a virus that only has one strand of genetic material, it tends to be an unstable kind of virus, like the influenza virus, which does undergo changes. And that creates problems with having a vaccine that works regularly, and you lose some of your immunity. If you've been infected once, you can get it again. At the moment, the information we have is this virus has been very stable. There may be two genetic variants, but they are probably very close to each other, and it doesn't seem to be at the moment a major problem. So if it remains stable, then it seems very likely that once you've been infected, you will develop antibodies. We still don't know about it, but that's the assumption at the moment.
Mm-hmm.
And you'll be protected then.
Yeah, sure. How does a country like the United States even go about, given the size and the scope and the amount of different states and people? I mean, Israel is much smaller. I assume it's easier to manage. How does a country like the United States even go about monitoring quarantines and things of that nature? I mean, speak about the differences regarding trying to manage this in a country like the United States versus a small country like Israel.
Right. Well, the quarantine process at the moment is really a temporary measure. I mean, it's something that we're going to have in place for a certain amount of time where we want to limit the spread. But at some stage, it's not going to really make much sense. It'll be like influenza. So you'll basically at that stage go into a kind of limited quarantine. You'll just ask people who are ill to stay at home and not go to work particularly, and so on. So, and avoid big gatherings, all the rest of it. But it's not going to be at the level that we are now. So as I say, at the moment, we're really trying to slow this outbreak. But I would guess the predictions are now that it's going to behave in a sense like influenza in terms of its spread. And that means that, and everyone gives a different measure, but let's say 10, 20% of the population get infected. Some have given higher estimates, but even if it's 10 or 20%, you can imagine it's many millions of people. So in 2009, in the pandemic, H1N1 influenza pandemic, it was estimated that about 20% of the United States population was infected, and that's 60 million people. So, we don't have to talk about 100 million, 60 million is enough. So if people are saying it's 70%, I would say let's work on the 20% or so number and say, okay, what's that going to do to us? Most of these people, as I say, are going to get over it very easily. And again, young people, or at least the working age people, will be much less affected physically. So in other words, that shouldn't really interfere too much with the running of the country. Where we'll have considerable pressure is going to be on the medical services and advanced medical services, where we'll have to give intensive care treatment to a large number of people, and that's a challenge. And they're also infectious, so that's an additional challenge.
Mm-hmm. Mm-hmm. It's reported that symptoms show about 5 days after infection of the virus. Based on your knowledge, does that sound about right?
Yeah, that's typical of these viral diseases. Anywhere from 3, sometimes you have an earlier onset. You can imagine it's a process of replication. The virus actually starts to replicate in you, and you at some stage causes enough damage to cause a response, which causes the illness. It can take up to they say 11, 12 days, so they've given 14 days. But it is possible that someone could get it, maybe would show symptoms after 16 days. It's not impossible. So we give a wide band of most people, but it really is an individual thing. So that 5 or 6 days is an average number.
Yeah.
And we use that basically to just test from the time somebody was actually exposed to the time we expect them to become ill. That's the 14-day period that's been chosen, which covers virtually everybody.
Right. Just want to remind our audience too, if there's any questions that our audience has, to please, feel free to submit them in the Q&A box at the in the bar below on the Zoom screen. One of our final questions, I think, but tell our audience, what should they do? I mean, everyone's in a bit of a state of panic right now. Let's say somebody comes down with a fever or perhaps has a dry cough, something that's an early symptom of this coronavirus. What's the first thing they should do? I mean, I assume they don't want to go to a doctor or a hospital, right? Just in case they might have it. Right. Tell our audience what they should do if they get worried that they might have it.
So again, we would divide the population into 2 big groups, if you like. The biggest group will be the younger population. We could argue what's younger, but certainly up to the age of 50, let's say. And these are people who will probably have no problem staying at home, obviously avoiding crowds, avoiding people, avoiding work and so on. And they'll recover with the usual drinking plenty of fluids and keep yourself rested and so on and so forth. The usual advice that we give for influenza. So in that sense, there's not really very much that they need to do to actually protect themselves in that sense. They must certainly stay away from others. And that's something we've had a problem with influenza, where people feel obliged to come to work even though they feel not well and so on. So they should actually remain, anyone who has a fever or they even have what they think is a mild cold, at this time should consider not going to work because they'll infect people at work. Right. So those are the big things. And we, for a period of time, and we have to start playing it by ear, whether it's going to be weeks or months, there would be much less interaction in big social gatherings. So that's going to be limited anyway. And at a later stage, I guess that will have to be relaxed to some extent because the society can't continue indefinitely. So it'll be for a period of time. Once we've done that, we've actually reduced the spread from these people. The others are going to be the population who are older and who have underlying conditions. If they have fever and symptoms of respiratory symptoms like a cough or difficulty in breathing, they should immediately contact a person, in other words, or a health authority, but they need to do it if possible. And I'm not sure what is being done in the United States. I'll tell you what's being done here. You have actually 2 numbers here. You can either phone the clinic, not the clinic, there's a call line, there's a on-call line where you can actually talk to someone and explain the symptoms and they'll give you some guidance. Or you can call the Magen David Adom, which is equivalent, I guess, to the Red Cross, but functions here also as a provider of the ambulance services. And they will actually send someone to test you. And if necessary, take you to hospital if you are in a condition where you need to be hospitalized. Right. So those are the ones. But early, for the people who are older and, as I say, with underlying condition, it's very important that they get to medical care very early. So if they have fever and a cough, they should immediately, call for some kind of advice. In other words, to get to treatment very early. At least treatment being support, basically.
Right. Yeah. Right. As director of the International Masters in Public Health at the University of Haifa, how are we preparing the next generation of global health leaders to deal with challenges like this?
Right. Well, we do a lot of leadership training in this program, and we also teach them about vaccines. But one of the things we've done just yesterday, we did an exercise on coronavirus. So in fact, we had them for 6 hours, actually role-playing different parts. So each one took a role, for example, a health minister of a different country, or a head of the World Health Organization, or a head of pharmaceutical industry and so on. And we actually posed them with questions where they had to actually develop programs or plans or answers, and also develop messages to the public. So they became very involved. They had to collect data, they had to work together in small groups, and they did an excellent job. It was really very, very enjoyable. We have 17 students from 12 countries, I think, and they were really very involved, very engaged. So that we do this commonly in other courses as well. So this is one of the things we do, but we do teach them the general public health courses. And in addition, we give them this kind of leadership aspect, global leadership role.
That's great. We're going to take some questions from the audience now that's joining us today. The first one that we have is, why isn't there a crash program to collect convalescent plasma for administration to the seriously ill?
Okay, first of all, there is, I know, ongoing efforts to try to collect serum or whatever plasma. I think there are a couple of issues with that. You need to obviously then, it goes through a very complex process to purify it and produce the antibodies and so on. So that's something that has to be done. The technology is available. It will be one of the efforts, I guess, one of the areas where there will be an effort to develop something which could be helpful. Remembering that we really have, that goes through a very strict process now. We don't want to infect people with using plasma or serum from somebody else who may be carrying something else. So we have to make sure that we eliminate any possibility of any other viruses or any other antigens in the plasma. So this is being done, and I guess it's still in the development stage. We don't usually use, there are two reasons for using it. We do use it sometimes for prevention. So what we might do is we may, for example, if we know someone's exposed, not in this case, but we do it, for example, for measles and for mainly hepatitis, things like that. So we actually give people that we know were exposed and are not immune, we may give them this immune plasma, this is what we call immunoglobulin, which is basically from plasma, antibodies. Mm-hmm. So this is more for people who were exposed, and we try to prevent the disease. There is another process of using it for treatment, which is a more complex one, which is not exactly quite the same as what we're talking about now.
Mm-hmm. Mm-hmm. Another question we have, in your opinion, how long does a country need to stay in lockdown to sufficiently slow the entry of this virus to lower the attack rates to the ones where, again, like we said, the health system can cope with it?
I think the most honest answer is that we don't really know. We're actually using data that we've seen from South Korea, from China, from Italy, and so on. And so China was very successful, but we have to add something to that. And I don't want to be too pessimistic, but I'm not so sure that once China starts to go back to work, basically, and to stop the quarantine or to reduce it, we may not see another wave there, because they've reduced their attack very dramatically. But it's quite common in these kind of situations for the next wave to come. Mm-hmm. Remembering, obviously, that 95% or whatever of the Chinese population have never been exposed. So right. It's not as if there's been wide exposure. So we nearly are almost playing it by ear and watching what's happening elsewhere. Mm-hmm. And I guess we'll have to just reevaluate every week, basically. Right. We've been discussing this today with the universities as to whether, should we want to teach online much more now, but for how long? Right. So we're going to keep reevaluating as we see the progression of the epidemic.
So you're saying that we actually could see a second outbreak in China when the quarantine is stopped?
Yeah, unfortunately, if the virus behaves again like influenza, and that's not unlikely because it does have characteristics in that sense of a viral disease that's a respiratory one. So it's commonly, and the other coronaviruses that cause a common cold. That means that we may see it going on for months, and it could go into the winter. So in fact, if that's going to happen here, it'll happen there. And, you may see the same kind of thing in China, that it'll go on to a low level of infection and then start going up again in winter. So this is a possibility, yeah.
Another question we have from an audience member is that what caused this specific type of coronavirus to be so infectious? And also why now? Like why this time?
Well, it's not just the coronavirus, it's many of these viruses that we call emergency infectious diseases that are often as a result of close contact with animals. either living with them or eating them or whatever you do. In other words, we get, encroaching on their habitat, basically. So they are actually a source of viruses that can infect humans. As I said, these are the viruses that are not human viruses. In other words, they don't normally affect humans. And they tend to cause very severe disease. So what we're seeing now with the coronavirus is one that causes relatively severe disease. I mean, it's severe enough. I'm not underplaying it. It's substantially more than influenza, particularly for the older. But it's not like SARS, which was very severe, where you had 10%, or MERS, which is from camels. So it's one of these viruses that's in between. Interestingly enough, the more severe the disease, the less likely it will carry on and be perpetuated like SARS, because SARS was so severe, it had a high mortality rate. A lot of people died that were infected. People who got it generally were very ill. So it was easy to identify. It was easy to separate the sick people from the well people. And the virus basically basically committed suicide in a sense, because it's not good for the virus for the hosts to die. Basically, the virus wants to live happily with you. And so that would be the ideal state of it. So in that situation, basically the SARS virus disappeared. It was, right. But that was very severe. Yeah. And MERS is somewhere in between. And this virus is more than influenza, but it's not severe enough to cause that kind of situation. So in other words, it will affect large number of the people who have mild disease, and they'll affect other people. So we're getting something in the middle now at the moment, in between, which is in a sense more problematic, because many more people will get infected.
Right. Another question we have that kind of follows on what you were just talking about is, what is the impact of seasonal changes in temperature, humidity, on the spread of the virus? And how can health authorities address the infection risk in nursing homes and assisted living facilities where it's primarily elderly people?
Well, there are two things. About the seasonality, again, it sounds strange, but even today, after all the research that's been done, we don't entirely understand the seasonality of some of these viruses, why they occur more in winter and more in summer. We have a lot of theories, and there are a lot of theories that seem to make sense. So, for example, in winter, people tend to be crowded in closed spaces, and they tend to come to more in contact with each other, so it's easier for the virus to move from one to the other. There may be some survival aspects of the virus. We think that for the cold, for the coronaviruses that cause the common cold, they tend to be more in the winter time. So, but they could be in summer, as influenza sometimes occurs in summer. And in the influenza pandemic of 2009, it started in the United States and Mexico in April, May, and it went through the summer. But it went through at a relatively low level, and then it peaked in the winter. So this is exactly, I think, what we would expect would happen with the coronavirus, that it'll go up, it'll start to drop, we hope that sometime soon, and then it may start, take another wave as it moves around, but still at a relatively low level. And then towards the winter, it may then, if we're unlucky in the sense, it then could pick up and go very high.
Just last question from our audience, I think, and a lot of people are traveling and people are trying to figure out what they can do to take their own precautions. Do masks work? I know a lot of people are traveling with masks on to try and help them not get the virus. Does a precaution like a mask actually do anything or work to protect yourself?
Well, the answer is a little complicated, because it does seem, we ask the medical personnel to wear masks, and we ask people who are sick to wear masks, and people would say, well, then it must be protecting. Well, obviously, the masks that are used by the medical personnel are generally, the more secure masks, the so-called I-95, but they may also be using surgical masks if they don't have the I-95, or they're working a long time with people who are not very ill. The problem with for the public to use masks is that it's virtually impossible to walk around with a mask all the time. And what happens is people either don't put the mask on properly, or it gets wet, or they put it on the table and then they put it back on. And in the end, it's counterproductive, and viruses just get in on the side. So if you calculate how your chances of being exposed and the time that your mask is actually protecting you, it probably doesn't have very much effect. We do ask people, for example, if they're with somebody in the home who is sick, to wear a mask when they're in contact with that person. But again, that's where you know there's a person who may be infectious. So by and large, we say to the public that there's no point in wearing masks. The other point, sorry, that I didn't address was the nursing home question. And that's an important issue. Or home for the aged and so on. You need to be careful. First of all, family members or friends and so on who visit should make sure they don't visit when they have fever or any evidence of illness. And this is something that should be strictly abided to. And also try not to visit with too many people at one time, because that is, but there's certainly you should take particular care when visiting these people. I wouldn't say stop visiting, because that doesn't make sense, but be careful, do it more carefully.
Doctor, I'm sure we could speak for another hour or two at least about this this pandemic, and I just want to thank you for your time. It's been incredibly informational and incredibly important. To the audience, I'm so sorry if we didn't get to all your questions. Our apologies. If you'd like to send, if we didn't get to your question and you'd like to send them to info@asuh.org. We will coordinate with Dr. Green to try and have him answer them in a timely manner. Again, that's info@asuh.org for any questions that you may have for Dr. Green. Again, thank you so much, and I will now turn it back over to Karen Berman for some closing remarks.
Yeah, I want to add my thanks to Dr. Green and to all of you for joining us during the middle or the end of your workday. I know with so much going on, making time for this is very much appreciated. And I know just with so much information and misinformation out there, having the opportunity to hear from an expert makes us all a little bit calmer. So we appreciate that as well. As Jake said, if you do have any questions, please reach out to us. We'll send a quick follow-up email so you have our information if you want to hear more about the School of Public Health and other things that we're doing. Really now it's just so critical, and we're so fortunate to have these kinds of experts and to have this opportunity. And we just appreciate your support and your interest in this work and helping us make it happen and making it available to all the people. It's obvious, the need is obviously critical, and so we're just appreciative of it. So thank you all. We wish all of you good health and keep washing your hands. So
thanks very much, Karen. Thanks to you all.
Thank you.